superior limbic keratoconjunctivitis, cytomegalovirus, esophagitis, and esophagitis. What's your diagnosis, team?
That's a funny way of saying good morning.
I think it might be a systemic viral infection affecting multiple organs.
Perhaps it's a severe case of gastroesophageal reflux disease.
I'm leaning towards an autoimmune response triggering these symptoms.
No. You're all wrong. It's Leber congenital amaurosis.
But that's a genetic disorder causing vision loss in children. How is that related to these symptoms?
Don't question me, Leslie. Frank Leslie, I want you to perform astrogalectomy on the patient immediately.
But Dr. Hawks, that's an extremely risky procedure.
Are you sure about this, Hawks?
I'm the one in charge here. Just do as I say. Leslie, Frank, I need you to break into the patient's residence and find any clues that could help us understand this illness.
Breaking and entering? Isn't that illegal?
I'm not comfortable with this, Hawks.
Enough. We need to save this patient's life. Now go. Tracy, I need to perform an astrogalectomy on my patient. I'm almost certain he has Leber congenital amaurosis.
Hawks, I know you're experienced, but are you sure about this? You've been wrong before.
Don't question my years of experience, Tracy. I'm never wrong.
I'm just concerned, Hawks. Your track record isn't the best when it comes to these risky procedures.
My track record is flawless. Stop questioning me and let me save the patient, damn it.
The patient is not doing well, Gary. We may have to reevaluate our course of treatment here.
You're right, Randall. It seems astral projection was not the solution for Leber congenital amaurosis, despite Dr. Hawk's insistence.
What do you think could be the correct treatment for this condition, then?
I wouldn't worry too much, Randall. We'll figure it out. Maybe some gene therapy could be an option.
I can't help but wonder what Leslie and Frank found at the patient's home. I hope whatever it is leads us to the right diagnosis and treatment.
Look at this, Frank. The state of this place is appalling. It's no wonder the patient is having health issues.
Seems like they have some pretty bad cleaning habits. But that's not what we're here for. Let's focus on finding clues related to Leber congenital amaurosis.
Right. Let's see. Oh, here's a prescription from Dr. Hawks. They must have been following his treatment plan.
But wait, this doesn't make sense.
The treatment listed here is astrogalectomy, but based on what we see in this home, it doesn't add up. This procedure isn't relevant to the symptoms we're seeing.
Astrogalectomy isn't a pill, Frank. That doesn't make any sense. Here, let me read it. It says Astrograph XL. Did you even finish kindergarten?
It took me a few years, but I pulled through and made my parents proud.
Was that 34 years ago or 34 weeks ago?
You incompetent fools. You nearly killed our patient.
Hawks, what we found at the patient's home doesn't match up with Leber congenital amaurosis.
It couldn't have been the right diagnosis.
Yes, Hawks, we made a mistake with the diagnosis. It happens, but we need to figure out what it actually is now.
What did you think was going to happen, Hawks? You prescribe astral projection. Well, guess what? Pseudoscience doesn't work.
Wait, you said astral projection earlier, Gary? That wasn't a Freudian slip?
What did you just say about my mother?
Astral projection. Astral projection. Are you shitting me right now? I demanded an astrogalectomy and you gave me astrogalectomy. Did you even treat the patient?
I tried giving them astral projection by napping next to them with the hopes of achieving a lucid dream that I would share with the patient so I could help them get better.
Wow, I'm almost at a loss for words. So the patient still has Leber congenital amaurosis, is in critical condition because you decided to take a goddamn nap.
I think Gary is proof that there has to be a God. There's no way anything else has protected Gary this much due to his terminal stupidity.
I pray that God does something about this.
How about praying I don't fire all four of you? You found nothing in the home, you didn't treat the patient at all, and one of you napped on the clock. I'm done. Get the hell out of my office. So, how are things going in the oncology department, Johnson? Any progress with your patients?
It's been a mix of good and bad news. Some patients are responding well to treatment, others are facing more challenges. You know how it is.
Yeah, That sounds tough. Speaking of challenges, I've been perplexed by this one case I have. Also, my doctors are total idiots.
Oh, really? What are you dealing with? Maybe I can help.
I think I've got it. It all makes sense now. I need to go attend to my patient immediately.
Wait, you're leaving already? What about lunch?
Sorry, Johnson. Duty calls. I'll catch up with you later. Thanks for listening. Sorry for storming in, guys, but we don't have much time here. I need everyone's attention.
Hawks, where's your protective gear? You can't just waltz into the operating room like that.
Seriously, Hawks, you're putting everyone at risk. What's gotten into you?
I know it's unprofessional, but I had a breakthrough. Leber congenital amaurosis was a misdiagnosis. It's ventricular extrasystoles with syncopal episodes, parodactyly, Robin sequence syndrome.
What? That's unheard of? How did you come to that conclusion?
I had discussed it with Dr. Johnson over lunch. Trust me, this is it.
What's the prognosis then, Hawks?
The prognosis is not great, but with early intervention and treatment, we can manage the symptoms effectively.
Well, I'll be damned. Looks like Hawks might have just saved a life today, despite Gary's futile attempts at astral projection.
You know what? At least I tried. Frank can't even read a pill bottle correctly.
I can't believe I missed that diagnosis, Tracy. Thank you for pointing it out and helping me correct it. It was quite a crucial mistake.
Don't be too hard on yourself, Hawks. Correcting it is what matters most, and you did that in time.
If only I didn't have such incompetent doctors working alongside me. Maybe this wouldn't have happened.
Hold on a second, Hawks. You were the one who initially diagnosed it incorrectly. Don't try to shift the blame to others.
But my team is full of idiots. One of them even slept next to the patient, trying to communicate to them through astral projection.
You're just making things up at this point. You need to take responsibility for your own actions, Hawks. You can't blame others for your mistakes.
I need some time to reflect on this. I'll see you later, Tracy.